All right, Dean still taking the lead here. That's $150 for the interview course of your preference, right? Ooh. All right, next question. Right. All right. All right. All right. So we had this question earlier, right? And I said that I would give you a more complete answer when we arrived. I think it was Mikael, I believe, that asked this question. I could be wrong.
Yes, it
Okay.
was me, doctor.
All right. So alcohol use disorder identification test, the audit, right? Audit is comprehensive screening tool for assessing alcohol use and identifying individuals with hazard or harmful drinking patterns. It is appropriate for assessing the current use in patients with a history of alcohol use. Now, let's do a strength and weakness, right? So, cage and audit are both tools used to screen alcohol use disorder, right? But they differ in approach and effectiveness. So let's start with cage. Before I start with the cage, I need you to write this down because this might be a question on your test. You need to know in detail what cage stands for because if you think you know, you might get four options with the letter starting with the letter E, and you will be confused. So, what does the C stand for?
Cut down.
Do
What
you have the
is the
need to cut them?
A stand for?
It stand for
Annoyed.
annoyed.
Mind?
Annoying, right?
Annoyance.
Now, here's something funny. I always thought if people felt annoyed. That's wrong. Is have you felt annoyed of others? Right? For some reason, I always thought people felt annoyed. Incorrect. The correct is have you felt annoyed because the others talked about your drinking habits. What's the G?
Guilt.
Guilt.
Guilty.
Guilt. What's the E?
Eye
Eye
open.
opener.
All right. Do not confuse this because they will ask you what's cage and they will ask you by the letter. If you think you know, they will confuse the heck of you. Another one, not related, but you need to know today, write it down. Pico. You need to know by the letter what PICO stands for because likely one of the two will come up and they will confuse you. If you think you know, but you don't know, you should really know. That's two other questions that you could get today. All right, before I go back on cage and audit, what PICO stands for? P.
Patient.
Patient
Okay,
Population.
problem,
population, right?
population,
Okay.
Intervention.
Problem.
I,
intervention,
Inter-
Intervention.
intervention. C,
Comparison.
com,
all right.
complement,
Comparison, right? O,
Outcome.
outcome,
Outcome.
outcome. And
uh,
usually T is,
Time
time,
frame.
Time frame.
All
time
right.
frame.
So back to cage. I didn't mean to digress here, but these are two important things that I every time I see something that I kind of remember and I think is important, I'll kind of you know, tell you so you write it up. So cage versus audit. So we're gonna look at a comparison here of strengths and weakness. So the cage is a focus identifying individuals with potential alcohol abuse or dependence. So that's good. The format is pretty simple. It's a yes or no, right? And if you have two or more, you are at risk. the strengths, as I would see it, is easy to administer and score. It's a yes, no, 4 questions, two or more, you at risk. One, yeah, nah. Three, you definitely there, right? Um, Another strength is useful in primary care setting for quick screening, right? Very quick. Can be a conversation starter, right? Rather than being like, here's your assessment. Weakness, as I see it, would be more like it's less sensitive than audit, meaning it might miss some cases of alcohol use disorder. Also, another weakness that I would see is that does not provide detailed information about the severity of the problem. It's a yes or no, 4 questions, you score, it's done. I don't go on by asking you how you felt annoyed and so on, right? It's a yes or no, 4 questions, done and out. So it's less comprehensive. Now let's take a look at audit. So the focus here is to provide a more comprehensive assessment of alcohol consumption, harmful drinking patterns, and the potential dependency, right? Remember, we use audit for what? When we're doing what? What's the tool?
Alcohol.
Well, let me rephrase this because it's NP or assessment audit is used on as far as the intervention.
The spurt.
Yes. So you judge your expert intervention by using the audit tool. Okay. So you use the audit to know if your intervention was positive or negative. All right. So back to the audit. It provides a more comprehensive assessment of alcohol consumption, harmful drinking pattern, and potential dependency. Format, 10 questions. Cage, 4. Audit, 10 questions. Varying the response option, right? Score 4 points. The strength here is more sensitive and specific than Cage in detecting alcohol use disorder. Offer a score that indicates severity of the problem, low, medium, or high, versus you have a problem or you don't have a problem. The weakness on audit, I would say, is like takes slightly longer to give, right? And you have to score compared to the Cage. I would say might feel more intrusive or time consuming for some patients. So when do you how to choose the right tool? It really depends. Cage, fast, yes or no, 4 question. Audit, more intensive, 10 questions and more detailed. Okay, so that's the difference. So the question asked for, oh my, let me see here. So the question asked for a more sensitive tool, more comprehensive. This is the reason why audit is the best answer. Does it answer your questions that we talked about earlier?
Yes, very clear.
Alrighty. Very nice. So moving on to the next question. Get ready, guys.
Where is the question?
Oh. You see it, right? All right. So what is the question asking you? And what are your choices? All right, we got 10 seconds left. Guys, pick your best answer. Don't let this question go away without at least trying. All right, one more second. Boom. Okay. So let's talk about this question here. All right. Before we do that, let's see who's on the lead. Janet. Okay. So Suboxone, right, is appropriate medication for manage opioid symptoms. All right. Let me divert here. Do not mix up SIWA with cows, right? So SIWA, what SIWA stand for? Anyone?
Clinical Institute
Clinical.
withdrawal,
Oh,
alcohol withdrawal.
Okay.
alcohol withdrawal.
The cows is for
Opioid.
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 I
Opioid.
have seen people mix them up. Two different treatments, two different way to go about it, right? So the cows. When do we start the treatment for cows?
5 to
Eight.
12.
8.
Okay. What's the first medication you do?
PRN.
Clonidine.
And the Suboxone. I don't know how to pronounce
Which one is
that.
it? If I score of 8,
Clonidine.
what?
Clonidine.
Yeah, you talk.
Clonidine.
Yeah.
Yes.
Are you talking
Clonidine.
about
Cows.
alcohol?
Well, we're
Which
talking about cows.
Okay, cows. You do
Cows.
Clonidine first. 5 to 12.
Score of 9. What do we do?
You did the Suboxone and the Propofol. The other one we just answered.
Okay, hold on, hold on.
Valium?
Different question here. Cows. The customer has a score of 9. What do I do?
Monitor.
Of 9 is 8.
Give the clonidine. PRN clonidine.
Clonidine. Okay, PRN clonidine. Right? Now the score is 15. What's the next med?
Give the Suboxone. The
Suboxone. Okay. All right. So now let's talk about SIWA.
Okay.
SIWA is alcohol.
Mhm.
SIWA. So let's say that the SIWA score is 8. What medication do you do?
You're gonna
Do
give
the
the PRN medication.
PRN.
Ativan or Valium.
Okay.
Yeah.
PRN what?
Advil.
Valium or Ativan.
Valium.
Ativan if
The
you have liver
benzos.
problem.
Okay. So I heard if the patient has a liver problem, you give Ativan.
Yes.
If it doesn't, you
Valium,
give
that's the
Valium.
That's
Okay. Don't be giving Xanax. Okay. That's not good. So how do you decide? Lorazepam L liver problem.
loves the liver.
Loves the liver. Okay. Why do you want that? Because it has a shorter half-life. All right. So now the score is 20. What do I do for SIWA?
You do PRN.
We give PRN and schedule.
Schedule.
Okay. So now I'm going to give the drug, PRN, and the schedule. Okay.
Yes.
So it's very important. Okay. So that could be done at 3-4 points. Right. So next question here.
Okay, really.
All right. We have 30 seconds. Pick your best answer. All right, we have 10 seconds, guy. Pick your best answer. Okay. So can anyone give me the rush? Well, if you like, and you pick the incorrect answer, can you kind of tell me, walk me through it, why you pick the other answer, or anyone? Okay, no problem. I get it, guys. Lorazepam, L is for liver. L is for liver. The person had liver problems, pick lorazepam. No liver problems, picks the Ativan. I mean, you can pick the other choice there for a benzodiazepine. Okay. So no liver problem, diazepam. Liver problem, lorazepam. Do I need to know both medications name, the brain and the genetic? No. The question always
No.
will give you genetic and brand. So you can just memorize one. L for the liver problems, lorazepam. No liver problem, you can give diazepam. All right. Hopefully, if we see a question like this, we will not miss it. Easy points. Okay. All right. First thing you do, ask yourself, what is the question asking me? So you don't get tricked. All right. All right. Very good. So, what someone unmute yourself. What are the three types of ADHD subtypes?
Inattention,
Yes.
hyperactivity,
Yes.
impulsivity.
Okay. We're not going to go over each one of those. Oh, hold on a second. I said, can you repeat that for me, please?
Inattention,
Okay.
hyperactivity,
Okay.
mixed with the impulsivity.
Okay. So you got mixed. Okay. Got it. I, yes, I thought you said impulsivity was one alone. So we have mix, hyperactivity, and inattention, right? Okay. So you need to know each one of them, what are the details of, right? So hyperactivity, can't sit down, inattention, forget the keys, or so forth. I'm not going to go there now, but you need to know. What you need to know is for ADHD needs to be in how many settings?
Two settings.
Two
Two
settings.
settings, okay? If the person is only hyperactive at home, it cannot be ADHD.
No.
All right. What are the medications? Which which stimulant can be given for children of 3 and older?
Amphetamine.
Amphetamine. 3
Mhm.
and older amphetamine.
About
6,
the dextromethazine, what's the age?
6 to 17.
Okay,
Six.
6. Now we
6.
have a patient that has ADHD, and patient went home. Life is great. Life is absolutely great. Improved education, listening, but develop a tick, mild tick, no big deal. What do you do?
Changer to guaifenesin or
Discontinue.
clonidine.
All
Clonidine
right.
one.
So, all right. So we're gonna change. Even the question will come something like, "Hey, life is beautiful. This person just changed day and night." But it's small tick, just a modem tick.
No.
You know, mom don't want to change it. What do? You change the medication. We have two alternatives, right? We mentioned here. Okay. So corners, is it on the primary domain? I mean, is it available to the public on yes or no?
It's not public domain. You have to pay for
There's
it.
not. Which ones are on public domain?
They vendor it.
Okay. So very good, guys. All right. Yeah. So another thing that I want to highlight for you guys is that the scales on the test most of the time will come with the acronym alone. That's bad news, right? Because it'll be like CRS slash R, right? And you got to know that's the Connors rating scales. Most of the time, it will not come with the whole name of the scale. For example, aims. You need to know what an aims is for. Okay. All right. Next question. All right. So we got 20 seconds here, just about, and we have 14 answers. All right. We got 10 seconds, guys. Pick your best answer. Well done, everyone. The Hamilton rating scales, Ham A. Remember, that's for anxiety, right? And we are assessing ADHD symptoms, Connors and Vanderbilt. If the question asks you which of the following scales you need two settings and maybe three different people, like the school teacher and the mother, right? At least two will be the Vanderbilt, right? So we do that at school. You give to the teacher and say, hey, what have you observed compared to the mother? And then we'll bring this to the doctor. Okay. All right. Moving on to the next question. All right. I want to see everyone get this question right. 100%. If you don't know, default to strategy. Okay. So, what did the question ask me? Ask me for autism spectrum disorder scale. Let's say I just got out of high school today and I have no idea what the MCHAT is or the Vanderbilt ADHD. Hey, guys, strategy. You look at something in the stem of the question, it said autism. I look at the question answers. I have a modified checklist for autism in toddlers, the MCHAT, right? So if I come across a question that I have no idea, at least try to match something that's on the stem of the question to the answer. That's the only question, that's the only answer that has autism on it, right? Not saying this is a must do for every question, but if you come across something that you have no idea, look at the stem of the question, look for words or patterns, and look at the answer. Most of the time, it may have something to do with the answer or in the stem of the question and in one of the answers. Okay, so if you didn't know what MChat is, you could have just default this question to the test taking strategies. Okay. Not the best approach. The best approach is knowledge. Knowing what the MChat stands for. You don't need to calculate, but you need to know that it is for ASD. I would love to talk more about ASD, but we can go on till midnight if I keep doing that. So we just keep on rolling here today. All right. So we have alcohol use disorder and motivational therapy. How do I motivate someone? Do I tell them what to do? Do I suggest what to do? Do I confront my patient? Or do I listen and ask for feedback, lead the patient the right way? All right, we have 2 seconds. Pick your best answer. Go. Boom. All right. Love it, the answer. You guys got it, right? Anytime you hear motivational therapy and you see confronting the patient, rolling with the resistance, it'll be incorrect, right? You don't want advice. You want to discuss with the patient their concerns, their views on alcohol consumption, right? You want to motivate them, not tell them what to do. All right, very good, guys. So I'm not going to dwell on this question, but always looking for reflective listening or motivational, empathy, and exploring the patient's feelings, right? So the fits all kind of question here. Do I provide education? Switch the patient to a different medication, maybe a better medication? Do I stress the role of taking meds? Or do I explore the patient's beliefs and concerns? We're using this for motivational, right? Motivational interviewing. What do we do there? All right, you guys getting it now. I love it, right? Provide the patient education on prescribed meds benefit. That sounds like a scientific answer, but we're using motivation. And how do we do this? Explore the patient's belief. Hey, what's going on with your medications? You know, what are the alternatives? What do you think about this or that? Right? Oh, okay. Oh, sorry, I didn't skip it. All right. Again, motivational interviewing. The problem is cost and the therapy, right? Time commitment. The questions: how am I strategy can help the PMHNP use to address their barriers. How are you going to address the two barriers that we talked about? Do I suggest? Do I recommend? Do I discuss? Or do I provide financial assistance? Right? It goes back to the same principle every time. If you start noticing the patterns, it actually becomes very easy. All right, so we get it. We're nailing it, guys. Right? So green option is a true statement. Remember, the pitfalls of questions always, most of the time, will be true statements. But is it what the question is asking you? You have to practice what is the question asking me, so I don't fall for this pitfall of true statement. Recommend group therapy as a more cost-effective alternative. Maybe, maybe not the true statement, but it's not even answering what the question is asking. The question is asking about am I? So every time the question asks about motivational is to discuss the patient's concerns about the cost and time and understand their values, right? Now I'm looking for the feedback of frame. Okay, good job, guys. Very good job here. Well done. So the feedback was provided, right? Oh, I kind of went too fast. Sorry. Okay. All right. So going back to frames, motivation therapy, what are, right, component of frames model to empower the patient on in this situation? All right, let's see what we got. You guys are getting it, right? So the frames, when it comes to motivation, answers like identify what the patient believes, core values, or explore, right? We don't tell them what to do on motivational therapy. We explore what the patient has and we work with that, right? So let's talk about MI for a little bit. So is the frame interviewing is the core principle behind motivational therapy, right? Uh, and has been established as a effective approach for fostering behavior change. While it is not a rigid set of rules, there are more core principles that and guidance that shape the effective motivational therapy practice. Right. So here, let's think about this: the collaboration, the spirit of a motivation in therapy comes with collaboration, acceptance, right? And compassion. Kind of those things need to be into the motivational therapy. Remember, I said if you ever find yourself fighting someone, then it's a problem. Then we have the ors. O was that OARE, right? Or so what we want to do is open-ended question. A is for affirmation, R for reflective listening, and E for illicit change or talk about, right? So that's why you see reflective listening coming up on the answers all the time, right? It's part of the core skills as OARE, ORS, open-ended question, affirmations. Hey, you can do this. Let's work together. Reflective listening. So tell me more about you want to change. How is that you want to change? What steps have you taken? Or illicit change thoughts? Illicit change talk about it. For example, I noticed that you've been alcohol free for the last 6 months. How do you accomplish that? For example, now responding to resistance, right? So you want to avoid argumentation. You roll with the resistance, or acknowledge the client hesitation and explore the underlying response. And you also want to do like a supportive self efficacy. For example, like build the client's confidence in their ability to change, right? Uh, what else can we talk about? Okay, I think that's enough. Okay, but you guys are getting it. If it's motivational, it's never confrontational. It's about exploring the feelings. Why do they want to do X, Y, and Z? All right, Dean still on the lead. Huh? All right, we got 5 seconds. Pick your best answer. Okay, so provide clear and specific recommendations for gradual exposure exercise, right? So let's see here. Okay, providing clear and specific recommendations for gradual exposure exercise aligns with the advice. The A's for the frame, advice, components of frames map. It offer the patient structure, actionable steps to face their fears incrementally, which can enhance their confidence and success in exposure therapy, right? So I wanted to also talk about frames a little bit and kind of just identify what are the components of frame. Okay? So F stands for anyone?
Feedback.
Feedback. Thank you. So the R we cover and we said there was responsibility. The A was in
Advice.
this case advice, right? So the M is a menu of options, right? A menu of options. So you have selections here. E is for empathy. And the S is for self efficacy within the patient, right? Can promote the optimism needed to achieve success in his endeavors or her endeavor. You need to know the frame um, letters, right? Because you don't want to be tricked. And that's an easy one because if you like, get couple F's in there or R's or A's, you may be misled on that question. Okay. If it comes back to identifying what the letter means. So,
PMH work in a patient diagnosed with bipolar disorder who has difficulty adhering to medication. Patient is less concerned about.
all right. We got 15 seconds. We need the answer here, guys. All right. Very good. Very good. So if I didn't know how to answer this question, which is not your case, you nailed it. I look at the theme of the question, had empathy, and then look at the question, I have empathy, offer other, offer empathy, and validate the patient's concerns about weight gain and sedation, right? We could use the strategy here, even if you didn't know the answer, just by using strategy, right? And we always want to offer empathy and validating the patient's concern. Patient had the concerns about the weight gain, right? And the medication. Yeah, that's a valid concern. Okay, guys. So why are you fearful? I wouldn't say like that, right? That would be rude. Why are you fearful of group therapy? I would say something along the lines of, tell me more about your fear of the group. Would you care to explain to me a little bit? Perhaps I can better understand your situation, right? So discuss the patient's concerns about the group therapy and help address their fears, right? So again, pretty basic. We getting it. It's a little rough at times, but we are getting it. We are moving on. Okay. All right. Which screen tool would we use for someone that's been on SGAs, FGAs for a while? How do we measure? And what we measuring? Use your strategy, guys. If you don't know, use your strategy. Okay. So my concern is TD. What about TD that will be concerned? Okay, very good. You got it. Even if you didn't know TD, you're concerned about movement, right? So for that reason, abnormal involuntary movement scale or AIMS is the scale that I use. Very popular. We measure that for TD. All right, so this is the best answer scenario, right? The most correct answer. Okay, guys. So postpartum depression is a very common condition affecting many women. Why would that not necessarily be the best answer? What's the most common? To mean 10%, 50%? It's kind of a true statement, but it's vague. More specific. Postpartum depression, postpartum major depressive disorder, or depression is a serious mental health condition that can affect women. That's more specific, right? If you hear a question about postpartum, look for the answer that says collaboration, collaborating with the OBGYN. All right, we have 15 seconds left. 10 seconds. Come on, pick your answer. Okay, guys, very good. So you want to conduct an assessment. So basically, assess to determine the severity of the self harm. Would I put someone in a hospital just because they're having suicidal ideations with no plans or intent? No, right? I would not do that. Um, so yeah, so assess. All right, we have a few more questions and we'll be about done today. So, what is she there for? It says desire for more effective coping strategy. Okay, great. So the question said, that's what she was there for. So you will read the question and ask yourself, what is the question asking me? And you look for the answer, right? Other answers sound good, but it's not answering the question. All right, we have 6 seconds. Pick your best answers and close it up. Okay. All right. I think the blue options there would be definitely the best option, right? So you conduct a comprehensive psychosocial assessment to identify what is the problem, the stressors and the triggers, right? Will
But I
help.
thought it explained what the stresses and the triggers are. That's why I didn't pick that answer.
True. That's actually very true, right? Is one of those are the best answer. Um, I think this one would be also the best answer, but it's true that what he said, the triggers there, right? Understanding these factors, understanding these factors is crucial for adjusting the treatment plan to address her current challenges, right? Just by saying, hey, I have problems with money, it doesn't necessarily tell me how, right? So the current challenges and support her and manage her anxiety symptoms more effectively. So again, it's one of those best answers kind of questions. So all right, all right. I definitely like the red and the blue, right? Which one would be the best? We want to implement, I should have said implement immediately, exposure therapy to desensitize Emily to the traumatic memories, right? Or is it a better option? Do trauma informed care principles to create a safe and supportive therapy, right? All right, Dean is definitely taking the lead there. Next question. All right, this is the last question of the day, and then we will do other teaching points. All right, so we have 15 seconds left. Make your best answer. 5 seconds. All right, perfect. You guys are on it, on the money. Marshall Lynham, don't forget DBT. All right, let's see who won today. All right, Mickey. Third place, Donna. You got the second place, and today's event winner is. All right, Dean. You did it. Okay. Hey, everybody. So, thank you so much for coming in today. I know it's late night. What we'll do today is take another 10 minutes break, and then we'll come back, and I have a few points that I want to discuss with you guys for your test, for your board, right? Some of the things that have been asked before. When do I pick X, Y, or Z options. Some of the few points that I have seen throughout